Have you ever wondered what disease could have been deadly enough to bring the mighty Athens to its knees? Well, around 2.5 millennia ago, in 430 BC, during the second year of the Peloponnesian War, a plague swept through Athens that was so deadly it claimed between 75,000 to 100,000 lives. This was not just any number, it represented a third of the Athenian population at the time. This plague, known as the Plague of Athens, was a veritable nightmare. It began, as many plagues do, with fever, a high, unrelenting fever that left its victims parched with thirst. But the fever was just the beginning. What followed was a horrifying array of symptoms. The throat and tongue would become bloody, and skin infections would break out across the body. The descriptions of the time paint a grim picture of the suffering endured by the Athenians, a people known for their strength, resilience, and intellectual prowess. The Plague of Athens was not just a health crisis, it was a catastrophe that shook the very foundations of one of the world's greatest civilizations. It led to a decline in Athens's power and influence, changing the course of history. But what's truly fascinating, or perhaps frustrating, is that we still don't know exactly what caused this devastating plague. Over the centuries, there have been numerous theories put forth by scholars and scientists. Some suggest it was typhus, a severe infection caused by bacteria. Others believe it was smallpox or measles, both of which were common and deadly diseases in ancient times. But despite all these theories, the true cause of the Plague of Athens remains elusive. It's a mystery that has yet to be solved, a puzzle piece missing from the vast tapestry of human history. The Plague of Athens was a mysterious disease that devastated one of the world's greatest civilizations, and its cause remains one of history's unsolved puzzles. What if a disease wiped out 60% of Europe's entire population? It happened, and it was called the Black Death. In the 14th century, humanity faced one of the most devastating pandemics in its history, the Black Death. This horrific disease left a permanent mark on the world, reminding us of our vulnerability and the devastation a disease can wreak. It's estimated that the Black Death claimed the lives of between 75 to 200 million people. To put that into perspective, that's roughly equivalent to wiping out almost 2/3 of the current US population. Imagine living in a world where the people around you are falling ill with fever, chills, and terrible aches and pains. They're vomiting, suffering from diarrhea, and then, in a short while, they're gone. Death. This was the harsh reality for millions during the Black Death. The symptoms were not just painful but terrifying, an ominous sign of the inevitable end. But what caused this catastrophe? The culprit was a bacterium called Yersinia pestis. This bacterium, invisible to the naked eye, was a silent killer that brought about one of the deadliest pandemics in history. Now you might be wondering, how did this bacterium spread so widely and so quickly? The answer lies in a creature so small yet so capable of causing massive devastation, a flea. These fleas lived on black rats, a common sight in the 14th century, especially in densely populated areas. The fleas bit the rats, got infected with the bacterium, and then bit humans, transmitting the disease. This transmission chain turned cities and towns into death traps. The bacterium didn't care about your status or wealth, it struck with deadly force, leaving devastation in its wake. The Black Death was not just a health crisis, it was a social, economic, and cultural catastrophe that changed the course of history. In the aftermath of the Black Death, societies had to reinvent themselves. The drastic reduction in population led to labor shortages, which in turn led to significant social and economic changes. It was a grim period, but it was also a time of transformation and rebirth, a testament to human resilience. The Black Death serves as a stark reminder of our vulnerability to disease. It underscores the importance of understanding the microscopic world around us, of tracking diseases, and of implementing effective public health measures. It's a lesson from history that continues to resonate today as we grapple with new health challenges. The Black Death was a grim reminder of how a tiny creature like a flea could cause such massive devastation. And it's a reminder that we must remain vigilant, for we share our world with countless organisms, seen and unseen, that can change the course of our lives in unimaginable ways. Can you imagine a disease so deadly that it could kill more people than World War I? That was the Spanish flu. In the year 1918, a disease swept across the globe, leaving no corner untouched. This was the Spanish flu, a pandemic that infected an estimated 1/3 of the world's population. That's right, 1 out of every 3 people on Earth at that time was affected by this disease. Let that sink in for a moment. The Spanish flu was not an ordinary flu, It was caused by an H1N1 virus with genes of avian origin. This made it particularly virulent and deadly. Unlike other strains of the flu, it struck down young, healthy adults in their prime, leaving communities devastated and families torn apart. The symptoms were gruesome and swift. It started with a fever and fatigue but soon escalated to severe respiratory issues. Many victims turned blue, suffocating from a lack of oxygen as their lungs filled with fluid. The speed and severity of the infection were so shocking that many people who were healthy in the morning were dead by nightfall. The Spanish flu did not discriminate. From the bustling cities of Europe to the remote villages of Asia, from the icy landscapes of the Arctic to the sunny plains of Africa, it spread with ruthless efficiency. In its wake, it left an estimated 20 to 50 million people dead worldwide. To put that into perspective, that's more than the total number of soldiers and civilians killed during World War I. Despite the staggering death toll, the Spanish flu is often overshadowed by the war that preceded it. However, its impact on global health cannot be underestimated. It reshaped medical research, spurring scientists to understand more about viruses and how to combat them. It also underscored the importance of public health measures in controlling the spread of infectious diseases. The Spanish flu was one of the deadliest pandemics in human history, reminding us of the immense power of microscopic organisms. What if a disease could bring the entire world to a standstill? We're living it right now. It's called COVID-19, a name that has become all too familiar in our daily lives. COVID-19, short for Coronavirus Disease 2019, is an ongoing global pandemic that started in late 2019. It's a novel disease caused by a novel virus, the SARS-CoV-2, which belongs to the larger family of coronaviruses known to cause illnesses ranging from the common cold to more severe diseases. This new virus and the disease it causes were unknown before the outbreak in Wuhan, China, in December 2019. Since then, it has spread globally, touching every corner of our world. As of this moment, more than 200 million people around the globe have been infected with this virus, and sadly, it has claimed the lives of over 4 million individuals. COVID-19 is primarily transmitted between people during close contact, most often via small droplets produced by coughing, sneezing, talking, or breathing. These droplets can land in the mouths or noses of people who are nearby, or possibly be inhaled into the lungs, causing the infection. The symptoms of COVID-19 are varied and can range from mild to severe. They may appear 2 to 14 days after exposure to the virus. The most common symptoms include fever, dry cough, and tiredness. Some people may experience aches and pains, sore throat or diarrhea. Loss of taste or smell and difficulty breathing or shortness of breath are also common. This disease has not only impacted our health but also our way of life. Schools have closed, businesses have shuttered, and entire industries have been brought to their knees. It has fundamentally changed the way we work, learn, and interact with each other. But amidst all this, we have also seen resilience. Scientists around the world have collaborated like never before to understand this virus, develop treatments, and create vaccines at an unprecedented speed. Healthcare workers have been on the front lines, working tirelessly to care for the sick and the dying. Communities have come together to support each other in these challenging times. COVID-19 is a stark reminder of our vulnerability and the interconnectedness of our world. It underscores the importance of global health security, of being prepared for the next pandemic because there will be a next time. We are currently living through one of history's deadliest pandemics. But we are not powerless. We can protect ourselves and others by wearing masks, practicing physical distancing, getting vaccinated, and following the guidance of health authorities. While the future may seem uncertain, one thing is clear: this pandemic will eventually end. And when it does, we must remember the lessons it has taught us so that we can be better prepared for the next one. We are currently living through one of history's deadliest pandemics, a stark reminder of our vulnerability and the importance of global health security. From the plague of Athens to COVID-19, diseases have indeed shaped our history in profound ways. They have challenged us, tested our resilience, and altered the course of civilizations. Yet, with each encounter, we've grown stronger, more knowledgeable, and better equipped to face the next. Our past battles with these formidable foes have propelled medical science to new heights. We've seen the advent of vaccines, antibiotics, and sophisticated diagnostic tools, all of which have been instrumental in our ongoing fight. But science alone isn't our only weapon. Global cooperation, nations working hand in hand, sharing resources and information, has proven just as crucial. And of course, there's the individual responsibility we each carry. Simple acts like washing hands, wearing masks, and getting vaccinated can have a profound impact. As we continue to fight against diseases, let us remember the lessons from our past and strive for a healthier future for all.